Some of them don't. Some of them continue to maintain their levels of symptomatic presentation. Some of them shift off and on. They get better, they get worse, they get better, they worse. The problem is that even when they get better, they still have the bacteria, the Lyme's bacteria, the spirochete in their cells, and it may not necessarily be reflected in their lab results or in their symptoms, and you have to find a different way. Well, there's two reasons for that. One, Lyme's is a great little hider. It gets into the cells, buries itself like a little drill into different areas, and it's tough to find out if you don't do the right testing. A lot of the bands that are not generally observed are positive, and not why they're not generally observed is because the wrong tests are being used, and you have to have a physician that really understands that there's other tests out there that need to be done. Unfortunately, insurance companies get into the mix, and they only pay for certain things, and sometimes the other tests are a little bit more expensive, and they don't want to do that. It's the same thing with allergy testing, which you've heard me talk about before. Antibiotics prevent or hinder the defense of the body's system, and in my observation over the years, I haven't seen a complete healing of Lyme's as a result of antibiotic therapy. There's markers that always show up, or people still have problems. There's different types of antibiotics out there, but those of you who have been treated that way know what they are, from Levaquin to you name them, and unfortunately, that's, if you have a recidivism, you go back and you're there. The only thing that I've ever seen that can put it into a suppressive place is that you have to use a combination of different herbal therapies, but you also use a combination of low-energy light laser or the biophotonics. Now, that's what we're talking about. We're talking about Dr. Wetzel's application of biophotonic therapy. And if a patient tests positive for Borrelia, you have to first treat them for the infection, and you treat them one way or the other. We get a lot of patients who've already been to their medical physicians who've been treated ongoingly with antibiotics, and if not, from functional medicine point of view, you can treat them with different types of herbal remedies and then also progress to detoxify the body. Then you have to make sure that the nervous system is balanced, and then you have to use photon therapy or low-energy light laser, or what is called biophotonic applications, and we're going to talk a little bit about what that is. There have been a few times when I've sent a patient out for intravenous detoxification to get rid of things and using different types of supplementation. But the bottom line is that you have to make sure that the immune system is working adequately, it's doing what it's supposed to be doing, and that you're not suppressing it. Because if you do a therapy that beats the body up and knocks it out, then you're stuck with trying to have to turn it back on. And sometimes you don't get the opportunity to do that. You just make the patient worse over time. And we're going to discuss more of that as we get into the next half of the program here at 888-630-9625. That's 888-630-WMAL. We're talking about Lyme's disease and why some of the things don't work, but a very interesting application of biophoton therapy, very similar to low-energy light laser. And we want you to visit us at rosellecare.com. That's ROSELLECARE.com. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am here in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. Perhaps you've had a problem. Let's put the fire out it. Let's see what we can do to make a difference. We're talking about Lyme's disease, actually a very special application of Lyme's disease as been used in Europe. Dr. Ingo Wetzel, MD, from Germany, is the guy that is doing most of this work. Master herbalist as well as a medical physician. He's a naturopath. He has a Master of Chiropractic degree from the University of Stockholm. And it goes on. But the bottom line is this guy knows how to treat Borrelia. And it's very similar to what we do in our practice when we see patients that are coming in with neurological patterns and pain patterns and so forth. As you know, we see a lot of patients who are in chronic pain and have been misdiagnosed. But if Lymes is not identified properly, and many physicians miss the boat simply because they're not running all of the bands. They run generally a Western blot, and if that comes up negative or if only one band is positive, sometimes they don't treat it properly. The application of antibiotic therapy in the initial stages sometimes is appropriate. Sometimes it can cause more damage than what it's worth. There's other things that can be done, and we're talking about one of those other things that, in my opinion, seems to make a very profound difference. It's called photobiotonic energy, and biophotons are transmitted throughout the body. Each cell has the capacity to put out energy, and it does it at a very specific frequency when it's working normally. Normal application is something in the neighborhood of 460 nanohertz to 635 nanohertz, and if everything works well in between that, each organ system, each cell has a little different application. But when you get something like Lyme's, it comes in and knocks it out. And what we're finding that there's very specific frequencies to help the body attack this microorganism, this spirochete that buries itself deep inside people. And what you need to know about Lyme's also is that it's communicable. It's passed through body fluids. It's passed not only through a Lyme's deer tick, but also through fleas and other insects, and it's much more profound than what we thought. We could spend the whole program on that today, but we're not going to. Before we take the next phone call, I want to remind you that Thermography Centers of Fairfax is offering you a full body examination this month, January only, generally $475. They're going to offer it to you for only $400. As I told you many times, this is part of my annual diagnostics. It needs to be part of yours as well. It'll show up cancer cells 5 to 8 years before they actually manifest with any other type of diagnostic imaging. Call Dareth Painter at 703-943-7248. That's 703-943-7248, and tell her you'd like to take advantage of that special offer. Let's go to the phones. Lou from Rockville. How can I help you, sir?
Yes, Dr. Roselle.
Yes, sir.
Well, I'm going tomorrow morning to get one of those body scans first.
Great.
But after I called, my right leg below the knee got very swollen and hardened. And I am wondering what's going on. It's now I'm in
severe
pain.
Is it hot? Is the leg hot?
No, it's not hot.
Okay. Is if you push your finger into the swelling area, does your finger leave an imprint that won't pop back out real quickly?
Let me try.
Give it a try. Just put your finger in, press hard, and then.
It's just all the entire leg.
So does your fingerprint stays there?
For a very short time now, it's coming out.
Okay.
Yes.
What type of medication are you taking?
None whatsoever.
Okay. And you said it's on your right side?
Only my right leg below the knee and to the ankle.
Okay. It can be a lot of different things, and from anything from a heart problem, and it can be a subtle beginning symptom of congestive heart failure. It can, and now when I say that, don't get excited. It's a symptom where you begin to see the backup of fluid within the body, and it's not something that's is irreversible. It can be treated. Now. It can be just the lymphatic system on that side of the body. There's something called a retrograde lymphatic problem, and that actually starts in the armpit on that side. There's a duct called the portal duct, and it goes into the chest, and the muscles of the shoulder sometimes get overly tight, and they put pressure on that portal duct, so you begin to see swelling on the same side of the body that portal duct is irritated. And it starts in the feet or the leg, and it can be in usually one side. Both sides can be involved, but it's often just the one side. You could have been bit. Look around the leg when you get a chance today to see if there's anything that looks like a little pin prick or a little pin irritation where something could have bit you, or 1 or 2 or 3 in a row. That also could be a spider bite. And if that's the case, something has to be done about it. What time are you going in to get the exam done tomorrow?
11 a.m.
Okay, I will be in the office, and tell the Thermography Centers of Fairfax has their office within ours.
Right,
and,
I understand.
And if when you come in, tell Dareth Painter to come and get me, and I will take a look at it.
Okay, will the body scan show if it's something vascular?
Yes, it will, absolutely.
Okay, that's what concerns me most, that
yes.
It's a blood clot in the leg.
Yeah, she'll show it up real quickly. If first of all, when she takes the scan, she'll be sending it out immediately, and you'll have the results back within about 24 hours.
Okay.
Okay, Lou, so thanks for calling, and like I said, tell Dad to come and take a look, or come and get me, and I'll take a look at it.
Thank you.
You're welcome, sir. Al, how can I help you?
I'd like to make a few comments. I'm not sure you mentioned the incidence of Lymes following a deer tick bite. It's about 1 in 200.
That's right.
And
then some people think it's even more than that.
Well, it all depends on what area, too. There's, I also like to comment about dogs. If you have a dog and the dog goes roaming around, here in Potomac we have a high Lymes area, and it's not unusual for them to get it from the dog.
That's right. Any saliva can transmit the Lymes bacteria, and it doesn't make any difference if it's human contact or if it's coming from someplace else. It's become.
This is more. The dog picks up the tick, and the tick.
That's right.
Looking for a warm place. And the last gentleman who called, I can make comment there. Number one on my list would have been deep vein thrombosis.
It can very well be. There's a lot of possibilities. We could spend the whole program on that, and I gave him a few very specific things that he needs to look at. However, obviously there are many things, and we don't have the time or the capacity to be able to explore that when we're talking about him.
But concern would be deep vein thrombosis.
Obviously, but unfortunately, he's going in tomorrow to have a very specific test that will show that if it's there. Anyway, when we get into a case of any type of vascular condition or any kind of problem, it's important that we be very thorough, and you can dissect the problem in many different ways. I could spend an entire program on that. We try to give the most common pieces of the puzzle, and also that's one of the reasons I told the gentleman that called before, as long as they're coming in there and I'm 20 feet away, come and get me and I'll take a quick look at it. We're here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. We're talking about Lymes and a very specific application of Lymes. And again, this is a condition we could probably spend all day talking about, and there are many conferences that do that. However, I'm trying to give you pieces of the puzzle because many of you are suffering from the exposure of Lymes. Many of you have positive markers and not showing significant symptoms, but the symptoms are everything from memory pattern losses to autism to neurological tremors and things like Parkinson's and things like MS in their presentation. And the morbidity, the quality of life that has been stolen from people is huge. It can have underlying and secondary problems with mold and fungus infections, which we seem to see with a lot of patients who have had Lymes, and it goes deep into the body. Babesia is a hitchhiker. It's a secondary bacterium that goes along with the Borealis, and the combination between Bartonella and Borrelia is often very difficult infection to deal with because it suppresses the body in a lot of different ways. Many physicians will use antibiotics. Many physicians will use herbs all by themselves, but in our experience over time, it seems that there has to be a significant combination of all of these things to work. But more importantly, what we found, and the reason that I'm bringing this up to you, is that photon therapy, utilizing some of the old Rife frequencies, but in the application of photons and low-energy light lasers seem to work well. 880 nanohertz seems to be the frequency that it's used, and I encourage you to go in and review some of this information yourself. Take a look. As I said earlier on, there's a book out there called Lyme Disease and Co-Infections, and you can pick that up on Amazon. Another book that I think that you may find extremely useful. It's called Insights into Lyme's Disease and Treatment, and it's a accumulation, if you will, a compounding of the thought processes of 13 different people who share the area of interest in Lyme's, and the treatments are as different as they are, and some of them are getting spectacular results. Unfortunately, most of the stuff that works, if you will, works and is not accepted here in the United States. It's done overseas. It's done in Europe. It's done in other parts of the world. We're seeing more and more things coming out of South America, out of Brazil, and less expensive, very straightforward, and the health of the individual seems to be much more rapidly restored. And that's what our goal is always, is to try